Welcome to Friday Value Videos, and this is part 3 and the final part to essential oils. I know in part 1 I might have said it would only be 2 parts, but there was more I wanted to share. Just a quick recap: wonderful therapeutic properties. Do not buy perfume industry leftovers. Make sure you use a carrier oil whenever you need to. Watch out for those populations that may be at risk of being sensitive to these things. But here is what I wanted to talk about for this part 3 is the potential interaction with prescription or over-the-counter drugs. Now, it has to be assumed if an herb predictably produces a certain outcome, there is a chance that interactions will occur with drugs that produce similar outcomes. For example, diuretic herbs and diuretic drugs. If you're taking medications that behave as a diuretic, a lot of antihypertensive medications behave like a diuretic. You need to find that out. You might be taking something that you know for certain is a diuretic. And then if you're using diuretic herbs on top of it, it might not be a healthy thing. You might be losing way too much fluid. So it's important that we understand the actions of these herbs that are in these essential oils. Now, an herb might interact with prescription or over-the-counter drugs, also other herbs, or even other modalities. An herb can affect drug pharmacokinetics, which is how the drug gets absorbed and how it behaves in the body. For example, herbs containing fiber, mucilages, or tannins could impact that. And then drug bioavailability might be enhanced or increased or sped up by herbs that increase the rate of absorption, and that might end up not being a good action in the body. And are you aware that even cayenne and black pepper act as stimulants? So I'm not saying that you need to be nervous to do this per se, but you do want to gain some knowledge. You do want to talk to somebody who knows about this. There's lots of great information that you can glean from experts in this. And I did provide a link in part 2, or it might have been part 1, but a really good resource link where you can learn a lot and make sure that you're doing okay, or maybe even seek out an expert. And then I want to share with you, I've never done this before in any of my Friday Value videos, but I'm giving you a link to Geek Corner number 7 from the Move Without Pain Private Club. And this is a list of essential oils for pain. I've got the safety reminders here, and then I'm listing the specific essential oils for different topics, different issues: inflammation, bruising, swelling, muscle pain, swelling, muscle tension, pain, tension, and swelling. And I'm going to provide a PDF download where you can print this out. So I really want you to have this information in case this can help you. And the last thing I'm going to talk about here is olfactory fatigue. Some people bathe themselves in cologne because they stop smelling it after a while and they think it's no longer smellable on them. And they're, oh, I like that smell. Let me put some more on. But guess what? Your olfactory system, it fatigues after a prolonged exposure to an odor. So you don't smell it after a little while, but it's still there. The person next to you can smell it if you walk up to them. The essential oil, you don't need to keep putting it on. It's still working. You don't have to put it on every 15 minutes. And again, a reminder to please be sensitive to others in your environment, because some people are allergic to many things and they may not enjoy what you're using. I had a patient that loved to bathe herself in cologne, and I felt like I needed to take a shower after working with her. And she always was my first patient in the morning for a while. And I was concerned about my other patients after that. I would wash my hands as best I could, but because I was in the room with her, I just had absorbed the scent of her perfume. And I was concerned about my other patients. And I would even tell them, I'm sorry, I'm not wearing this perfume. It was another patient, just so that they wouldn't think that I was inconsiderate of their specific needs. So we do need to be considerate, especially if you work in the healthcare field. Please don't be putting these things on. If you're working with other patient populations, you could end up harming people. So that said, I hope you got a lot of benefit out of this 3-part series, and I look forward to coming back next week with more tips and information that is intended to improve your life. Have a great week.